Hello everybody, welcome to the second module on developing resilience to stress. In this module, we shall study about the personality patterns, locus of control and self-esteem and how these are seen in the stressed individuals. So, we will actually discuss some of the scales that we can use to assess personalities and for locus of control and self-esteem, and how in this case we will talk about how self-esteem can be improved. So, before I start today's session, I must remind you that this lecture on stress management, this series of lectures on stress management may be a little different from some other courses that you may be attending. The reason being that this course, I am trying to make it as lucid as possible, because this is a multidisciplinary course and I believe that anybody who is keen to learn more about stress management techniques and also wants to apply it on himself or herself can attend this. The second thing is, so that is one of the reasons for making this a very lucid for everybody. The other is that I feel that here it would be better if you could use some of the techniques on yourself and also learn it very briefly, perhaps to use it on others if required. Of course, why I am mentioning this is in this today's lecture, when we are going to talk about the different personality scales, most of it will actually require a trained person to administer the test. So, you may not be able to administer it by yourself if you are not a trained psychologist, but I just want you to give a briefing and to understanding of what these are. And for many of these tests, you can actually assess your own stress level, your own personality level by using these tests online. I will give you some links as well. So, to start off today's session, we will start with some of the stressor scales, and I feel you need to be a little familiarized with these scales. So, we start off with social readjustment rating scale, which is one of the most popular scales in stress management. So, Holmes and Rahe in 1967 based this scale upon the theory of life change that is associated with subsequent illness. So, this scale of social readjustment actually has 43 items and they consist of commonly experienced life events. Each life event is weighted with a life change unit score or LCU, and respondents are simply asked to check each of the items they have experienced within the last 12 months. We spoken about life events earlier, so this scale considers all the positive life events as well as the negative life events. There is a presumptive stressful life event scale that is an Indianized version of it, PSLES, which has in 1982 Singh and Kaur published it. So, you can also look that up. This is also a very nice scale and this is easily usable in the Indian population. Some of the other scales are life experience survey. This was published by Saracen and others in 1978, and this is also a scale on life events which inquires into the desirability of each of the events. Another very important scale that is usually used to measure stress is the hassle scale. This looks at the daily hassles versus major life events that pertain in the prediction of subsequent illness. So, this is also a very common scale that is used by investigators during stress reactions. This lists a series of minor daily hassles and that is a source of frustration that commonly recur to many individuals. So, it could be something, some of the items are related to traveling regularly to office, and again people assisting staff not coming home to help you. So, the disadvantage of this test is the daily hassle scale is that it is a little extensive, having around 117 items. The Hassel scale also has an Indian adaptation to it, and you could Google it and find it out. Now, this is also a very popular scale known as Millen's Behavior Health Inventory, and again it is also a very extensive scale. It has around 150 items, and it is a self-report inventory. So, a self-report inventory is something where the individual responds himself. So, writes down whatever is going on in his life. So, it is in that inventory, it is not asked by another investigator, and you are just giving that investigator your responses. So, this has been normed on medical patients. Because it is a health inventory, it was primarily used for medical patients. So, maybe this is though this is a very popular scale in the clinical population for adverse effects or seeing adverse effects of stress on ill health, but you may not be keen on seeing this. Some of the psychological measures are here. When I am talking of the psychological measures to see the effect of the stress response, I am primarily trying to tap the personality scales. Now, the most popular personality scale is the MMPI or the Minnesota Multiphasic Personality Inventory. Now, it has 10 basic clinical scales, and it samples a wide range of maladjusted personality traits. Now, what is a personality trait? A personality trait is a rather chronic and consistent pattern of thinking and behavior. So, you could actually identify an individual with a personality trait. Say somebody could be aggressive, somebody could be anxious. So, the only disadvantage, it is a very extensive scale, and this is very widely used in psychology, but to understand the personality patterns, and you need to be extensively trained to administer the MMPI. But the only problem with this scale is it is extremely extensive, and it has around 560 items. As you can well understand, there are 10 basic scales, so that to explore all the factors of personality, it has made this scale too extensive. Again, one of the most popular scales that are used among college students is 16PF. So, this 16PF means 16 personality factors, and this scale, though it has 187 items, it is also very extensive, but it is assesses a wide range of personality traits. And why the name 16PF is, this was done by Cattle, and the reason it is known as 16 personality factors is because it measures 16 functionally independent and psychologically meaningful dimensions, isolated and replicated in more than 30 years of factor analytic research on normal and clinical groups. So, this has been a widely researched scale and extensively researched, and they have come up with after a series of factor analytic researches, it has come down to 16 factors. So, this scale also has several norms for the college population, the adult population, and people for even for 15 years of age group onwards. So, this several times is used even in the college settings. Now, MCMI, one of the reasons being that it has been the norms have been researched on normal groups also. MCMI 3, or this is a recent version, and Millen was first researched and found out by Millen 1997. That is MCMI 3 came out in 1997. Before that, there was MCMI 2, and it is a 175 item report and with true or false questionnaire. Again, as you can see that all the personality scales are a little detailed, and this is the MCMI 2 scales. So, it talks about the several types of personality types. So, the schizoid, avoidant, antisocial. I will not get into details of this. You can look it up. I will give you some links for you to look it up. So, basically the MCMI scales deal with these variables, and in MCMI 3 the additional content includes child abuse, anorexia and bulimia. Now, the Stanford Acute Stress Reaction Questionnaire, this is also a very popular scale, and this was found by Spiegel and others, and this is a primarily short scale. Now, we get back to the stress reaction questionnaire. So, we have talked about the three, I have spoken about 3 personality inventories primarily, MMPI, 16PF, MCMI. There are several other personality assessment tools considering the Neo5 inventory, the EPQ and several others, but I have just spoken about some of the very basic scales that are used to understand the personality. Now, that brings us to the Stanford Acute Stress Reaction Questionnaire, which is a 30 self-report items that assesses acute stress disorder. This scale is widely used primarily because it takes very short time. So, it is around 5 to 10 minutes that it takes to complete and is very helpful in assists in identifying PTSD, in predicting PTSD. So, that's PTSD stands for post traumatic stress disorder, which we have discussed earlier. So, post trauma follows, as the name suggests, after a traumatic stressful condition. So, it could happen between the next day immediately after the traumatic event or even after 6 months of the event. So, now these symptoms are of acute stress. So, just reliving the images, having nightmares, bedwetting, a lot of other symptoms include the sympathetic activations. Now, getting to the STI, the State Trait Anxiety Inventory, or the STI. The STI is a wonderful test which is used and in the psychological population very frequently to assess anxiety, and it is a very popular scale. I will just show you the test. The test has 20 items in the first scale. So, that is, it measures the trait anxiety as the name suggests, and the state anxiety. The trait anxiety is actually, it measures whether the individual has a personality trait or personality disposition to be anxious. So, in simple terms, whether he is anxious by nature, and the state anxiety measures whether an individual is anxious in a particular situational state. So, both the tests, so we have 2 scales, one is the state scale and the trait scale, and both the scales have 20 items each. So, the trait scale where it differs is in the instruction, where it talks about how the individual is generally feeling, and in the state scale it is more like how you are feeling now. The STI can be administered in a full form of 40 items or be used to measure either state anxiety or trait anxiety. I will just show you STI before we move on to the other scales. This is a form of STI. See how the instructions or the directions are different. So, this is the state scale. So, it talks about a number of statements which people have used to describe themselves are given below. Read each statement and then circle the appropriate number to the right of the statement to indicate how you feel right now, that is, at this moment. There are no right or wrong answers. Do not spend too much time on any one statement, but give the answer which seems to describe your present feelings best. As you can see that this is a 4-point rating scale. So, it goes from not at all, that is 1, to very much so, that is 4. So, you actually encircle what is most appropriate for you right now or at this moment. As I was talking of, in the STI scale, the state scale, here it talks about how you are feeling at this current moment. Now, we come to the STI trait form, where you see the instructions are a little different. Here it says read each statement and then circle the appropriate number to the right of the statement to indicate how you generally feel. So, the difference is how you are feeling right now. So, right now at this moment and how you generally feel. So, this is actually talking about the personality disposition, and again the items are the same. So, as you can see, this is very simple and small. So, it does not take too much time to perform. That brings us to the other personality scale. In this case, we are talking about the to identify whether personality as a factor is inducing stress. So, we have spoken about the other personality scales when we are talking of anxiety and to identify the different traits. Here we are talking about one more important factor that we have already discussed that has an important role to play in stress. So, the personality disposition or of type A personality. So, we are going to see the Jenkins activity survey that tells us whether an individual is more of type A or type B personality. Here there is an online link which you can where you can take the test by yourself, and this is primarily for college students. They have changed a few items to help the students to understand their situation better. So, instead of work, they have changed a few to college. So, but this is a very good test that you can use yourself to assess whether you are a type A or type B personality. Now, I will just show you Jenkins activity survey. See, everywhere you will see that they mention, it is mentioned that each person is different. So, there are no right or wrong answers. When we were seeing style, there also we saw that, and here also. The reason being that it is because of the uniqueness of the individual. When we are understanding an individual as per his traits, and we must remember that each individual is different. So, this is the test, and as you can see that there are 3 response categories, of which you can, for some it has 4, for some it has 5, and in this case some has 3. So, these are 3 response categories where you have to tick what suits you most or what defines you most. So, do not use too much time to think. You can take that online survey, and here as you can see there are 52 items. You can take that online survey to understand whether you are a type A personality and whether your personality pattern, if you are stressed, is actually affecting your stress in life, stressful situations, or how you comprehend stress. Also, another very important factor is that whether type A personalities, remember that it is not only stress that it is related to, but also striving and doing well. So, if you are a type A personality, there is no reason to feel distressed about it. You can always, once you are aware, you can control your stresses, but not only that, you should also remember that type A people strive a lot, and if they can effectively manage themselves, then they will do much better in their performances. So, they can actually optimize their work. So, that brings us to locus of control. So, the major thing that we need to understand is why is locus of control important when we talk of stress. So, what is locus of control? This idea was given by Rotter in 1954, and he stated that the degree to which people believe that they have control over their outcome events in their lives as opposed to external forces beyond their control is how we should define the locus of control. So, people's loci, or the plural that comes from the Latin word location, is either internal for those who believe that they can control their life, and external, that is for those who believe that their decisions and lives in life are controlled by environmental factors which they cannot influence, or that chance or fate controls their lives. Now, just if we get into this a little more in detail. So, individuals with an internal locus of control are more corrective in their measures. So, they have a habit of personalizing things. We will talk about personalizing again. So, and they blame whatever is happening in their lives, they blame it or ascribe it to themselves. So, they believe that events in their life are derived primarily from their own actions. So, when for example, when the results are out of an interview or an exam, people with an internal locus of control will either praise themselves or blame themselves for their abilities. So, they might have an critical attitude, if it is overcritical attitude also at times, or also appreciate their commitments and their actions to bring about the results. But people with a strong external locus of control tend to praise or blame external factors such as teachers in the exam. So, it could be something like, oh, if it is a positive result, oh, it was because the fate had been with me, so I have done well. Or it could be something like, the examiners were awful, so I failed the exam. So, either ways, external locus of control, as you can understand, shows that the individual starts feeling that he has no control over the events that are happening in his life, or over the situations that he is undergoing. So, we have discussed this earlier, where we spoke about managers who lost their jobs, and the people who thought that they had control over their lives would perform better, were still healthy as compared to people, and they got jobs again, while the others who felt that they had no control over their lives were suffering from several illnesses and also getting into depression. Now, I will just show you the forced choice scale by Rotter in 1966. It is a very popular scale, and it is a 23 item scale with 6 filler items, just to check if it is a computer doing the test or if the person is randomly marking answers. And again, this test you can actually take up from the online. It is a very interesting scale, and you can actually identify whether you have an internal locus of control or an external locus of control. Now, we must remember that higher levels of external locus of control combined with lower levels of self-efficacy are related to higher illness related psychological distress. So, what do we mean by self-efficacy? So, it is self-efficacy. I will not get into the details, but self-efficacy is more related to how an individual evaluates himself, and one of the domains of self-efficacy is self-esteem, which we will discuss right after. Roddenberry and his colleagues in 2010 found that individuals who have a high external locus of control tend to have higher levels of psychological and physical problems. So, that these people are more vulnerable to external influences, and as a result they become more responsive to stress. So, this is also a very interesting study. I will upload this paper for you, so that you can go through this. That brings us to self-esteem. We just spoke about self-efficacy and one of the domains, co-domains being self-esteem. So, what exactly do you understand by self-esteem? So, it primarily means how you evaluate yourself. So, how you see yourself, So, now the next question that comes in is, do you think your self-esteem is high or low? Do you know what to do about it? So, is it good to have a high self-esteem? Is it good to have a low self-esteem? So, many times, our society actually, the Indian society makes us evaluate things and express it in a different way as compared to the Western society. It is not only the Indian, but the Oriental society expresses their efficacy in a different way as compared to the Western. So, even if we do well in something, we do not express that pride in our in the way we talk. So, many times it may come out like, oh, it's because I have done well, I have got this achievement because it is not my doing, it is God's will or something like that. That necessarily does not mean that the individual has an external locus of control, nor does it mean that the individual has a low self-esteem. So, it is not the way you are expressing. So, several times we say that, oh, I have seen students say this, that I have studied self-esteem very well, and then somebody has just told me that, oh no, I am not that good, I just worked hard and I got this. So, he has a very low self-esteem. It's not, that is not true. The individual may have learned that this is the best way to express, and this may have come about from his early experiences and how the family has and school has bred him, but it does not mean that the individual evaluates himself as not being efficient or not being able to do well in a situation. So, that again I come to this, that we learn self-esteem from our family of origin and from our schools, but we do not inherit it. So, it is also, so it is not only how does family have an influence, it not only tells us by the way they appreciate us over our behaviors over the years, but it also many times the verbal responses and the non-verbal responses both are effective ways to build up the way we think about ourselves or the way we evaluate ourselves. Many times these evaluations are also wrong. So, maybe that a person is not very good at singing, but his parents have always told him that he is a wonderful singer and he sings well. In this case, there is a correction of the way he evaluates himself when he comes to college, and there are people telling his friends are telling him where he stands, and so it is not always bad to be criticized or told by friends. So, there is a recheck of the way we evaluate ourselves in between early adulthood, late adolescence and early adulthood, where we evaluate ourselves and see where we stand. Many times it becomes a problem for individuals to accept that they are not good enough. So, that is because they had a wrong perception of themselves. So, it may not be wrong always, it may be a little different. For example, say think about students who have been really good high achievers in their school and in their neighborhood, in their state, in their university, and then they go to a different place where so they have always been praised by people, appreciated by others, and told that you are the best student and you are really good and nobody can beat you. So, this person has got this in his head, and that is how he goes to college, and there he is a small fish in a big ocean. So, there are many students like him who are the toppers in their class, in their whole family and in their neighborhood, from their village, from their town, from their state, and who are national champions. So, there the individual starts evaluating himself, reassessing himself, and many times that becomes a problem for that student to accept that I am not as good as how I thought myself to be. Now, if the individual has a positive self-esteem, then he will take in more of corrective measures. But if the person cannot accept, then it may several times lead to stress and depression. So, global self-esteem or of who we are is normally constant. So, that is not very shakable. So, what I was talking of right here, that if I know I am good and in this situation I may not be as good as others, then I will be able to deal with the situation and plan out techniques. But if the situational self-esteem is where we actually, which fluctuates. So, it depends on situations and depends on roles and events. So, maybe I am a very good student, but I am not a good team member. So, it could be something like that. So, this keeps fluctuating, but again it does not necessarily fluctuate too much from the global self-esteem. So, now low self-esteem is a negative self-evaluation of oneself. So, this type of evaluation usually occurs when some circumstances we encounter in our life touches on our sensitivity. So, we start feeling that no, it is a jolt where that the individual starts feeling that I am no good, and we personalize the incident. So, if the individual through one incident tries to generalize all other situations, so I have failed in this exam and that just shows that I am not good, I am no good, and he generalizes it to all other situations in his life, then definitely it marks in other stress responses. So, generally a person with low self-esteem responds in a self-defeating and self-destructive manner. I will just show you the vicious cycle of self-esteem, and the actions become automatic and impulse driven, and the individual's thinking pattern narrows. So, it is more restricted and related to finding out other negative examples to show that I am not good or I am no good, and the individual loses a sense of self or focus on being in control and becomes more self-absorbed with his or her activities. I will just show you the vicious cycle of self-esteem. So, think about a person with low self-esteem. Okay. So, he does not, so less exposure. So, he does not, if he can say he has got a talent, but he sings well, and he says, oh no, I am no good. So, he does not take in the opportunities that comes his way. So, once there is, so this is less, so he does not take opportunities, so there is less exposure. So, when there is less exposure, so there is less chance to show to himself that he is good. So, this just increases his idea that I am no good. So, low self-esteem is I am no good, and when he starts thinking that I am no good, so gradually what will happen? He will get less opportunities. So, first he did not use the opportunities, then gradually if a person does not sing, then people will ask him less to sing. So, when there are less opportunities, that just makes him think that, see, so there is a cognitive appraisal of it. So, he thinks of I am not even being asked by others. So, that just shows that I am no good. So, this is the cycle of self-esteem, and that needs to be broken somewhere. So, it is, so how do we break this? So, here we will go back to the ways of raising self-esteem. So, practicing more of self-care. So, identifying the triggers to low self-esteem. So, if one of you or if any of you are going through this cycle of low self-esteem, try and do this vicious cycle and see whether you are actually being overcritical about yourself, whether you are being too personalizing. So, the next step is stop personalizing. So, are you actually taking it all down to yourself? So, is it that I am no good, you are deducing from one event. So, and you are even if it was told to others, you have come out with this idea that it is told to me only, and you are generalizing it to other events. So, I am no good if it happened in one situation that you have evaluated yourself. It need not be that in every exam, say if it was an exam where you did not perform well, does not mean that you will perform poorly in all exams. It does not mean again that you will perform poorly in that same paper all the time. So, there is, and not only exams, it does not mean that you are no good. So, you being good or you being not good is not dependent only on one factor, your exam. So, please stop and take notice, pay attention to the familiarity of this impulse of constantly telling yourself that I am no good, acknowledge the reaction. So, the next time you think that, oh, I cannot do this, or you have a negative statement for yourself, just stop and tell yourself, see, I am doing this again. So, actively stop that by being aware of the situation, rather than, oh, I know I have this habit of saying, I have this habit of always criticizing myself. So, that is a passive way. Instead, you could do it more actively by saying that, see, here again I am saying I am no good, stop. I am going to see this situation as a fresh new event, and let me see how I do. So, I am not going to think about what has happened in the past and not generalize one event with in all situations. So, hold self-defeating impulses. So, if one of the self-defeating impulse that I was talking of is not taking the opportunities that are coming your way. If you do not take these opportunities, then you will not be able to prove to yourself that you are good enough. So, these are some of the responses, and develop skills. So, it is also important to understand what your body is going through. So, what are the feelings that you are going through, and appreciate the feelings that yes, I am anxious, but that does not mean that I cannot deal with the situation. So, this anxiety is actually going to help me to do well. It is not that I am the only person who is anxious and another person beside me is not anxious in such a situation. So, this anxiety is actually going to help me to do well in the situation. So, optional thinking. So, it is not the end of the world. So, it is not like if I do not do well in this, if I do not get this job, that just proves that I am no good at all. So, it is not a black or white world. So, now if you have such assumptions of people, you relating to people in comparisons, then you need to stop that. Now, assertion, if you are feeling something, be assertive about it and learn to say no. Assertiveness training is a huge, that is another form of technique that is very important for stress management, and also it's very important to dealing with stressors in this situation. So, it's very important to learn to say no. And receptivity. So, listen to others' words and meanings to restate them. In this way, you can act with an awareness of your contribution to events as well as empathize with the needs of others. So, rather than being self-absorbed and self-critical, you listen to others. That way, you will be able to form more better interpersonal interactions, and effectively that will help you to appreciate yourself better also. When others appreciate you, you will also be able to appreciate yourself better. So, in a nutshell, do not lose out on the opportunities. I will ask you, request you not to take the opportunities that come your way. So, the major things that you need to remember is stop personalizing. So, don't take everything to yourself, oh, this is my fault, and don't generalize it to an overall pattern, like I am no good I did not perform well in this, means that I cannot do well in all examinations, I am no good in anything that I do, I cannot satisfy my family, and it comes, so one negative thought leads to the other. So, when you are personalizing, when you are generalizing, tell yourself, stop, see, I am aware that I am actually doing letting the negative thoughts come my way. So, stop that, and be aware of it, that by itself will help you to stop. You can control the situation, believe in yourself, put it down on your screen or your wallpaper as a wallpaper, put in positive quotes, tell yourself I can do it, and do not lose out on opportunities, use them. Listen to others, interact with others, you will also get the feedback from them, and that will help you to do better. So, in today's session, that is what we've discussed. So, we've talked about the stress scales, the personality scales, we've spoken specifically about the type A personality pattern, locus of control scale, and of course, we've spoken about self-esteem and how to enhance the self-esteem. Thank you.